Friends, a very brief journey of what we mean by technology tips beyond medical apps. I will be covering in very brief what is artificial intelligence, what do you mean by augmented, virtual and mixed reality, what is the blockchain technology, how the pharmacogenomics is going to change the therapeutics of the next generation, and remote monitoring of vitals, something called as the Internet of the Things, IoMT. Do we really believe in something called as the organ manufacturing, or a lab on a chip, or an organ on a chip? What is the role of robotics and something related to quantum computing, which is helpful for medical profession, and what do we mean by deep learning and machine learning? I'm not going to bombard you with some rocket science. First of all, I'm going to tell you what are the carry-home messages. AI and technology can support coordinated health awareness and healthcare, but it has to be customized to one and it should be connected to all. It is collected for the insight and future. The healthcare is going to be really different in the next 5, 10, 15, 20 years. AI and technology does not drive our mission. We should drive the technology and achieve the mission. And it is not should we use, but we must use them. And if not, please start using from today and share it with everybody. That will be changing your way in which you practice. Friends, Dr. Kulkarni is here. I can't forget my alma mater, my legacy, my roots. The best example, what you can see about the technology is the hybrid closed loop insulin delivery system. It has been in process for years together, but it has come to a reality. What was the motivation to develop AI? If why the doctor needs artificial intelligence, does it mean that he is not intelligent enough? But doctors in a box to diagnose the disease. And there is a community of computer scientists and healthcare professionals which set a research program. And this AI in medicine is going to revolutionize the way in which we are going to practice in the few years. Look into your pockets. Imagine what was there in 1985, what was there 4 years back, and what is you are having in the right now in your pocket. The way in which technology is shrinking in size. You don't require a desktop, you don't require a laptop, mobile is everything for you. What is AI in medicine? It is primarily concerned with the construction of programs that perform diagnosis and make therapy recommendations. Medical AI programs are based on the symbolic model, and these are very specialized medical applications. It uses a concept called as a machine learning or a deep learning. What do you mean by deep learning? It is like the layers of the neuron, how they interact and intersect, go down. So the decision-making process starts from say 100 or 1000 or 10,000 and it goes down to 10, 5, 2 or maximally 1. It uses stored data for diagnosis. It creates and analyzes the relationship within data. And the best example is the drug discoveries. What is the goal of artificial intelligence in medicine? It exports computer programs for the clinical use, dissemination of the best medical expertise system, and to formalize medical expertise. And the systems are the knowledge-based system and diagnostic and educational. You can have some data which it can give a answer like pat, that this can be the clinical situation what you are going to get out of this. In the knowledge-based systems, it uses the medical knowledge stored for reasoning. It stores information about a specific task. If you are talking of demyelinating diseases, it will take only the demyelinating diseases, various types, and try to cover it to cone down to its place. It supports healthcare workers in a normal course of the duties. Manipulation of data and knowledge is possible. For example, generating alerts and reminders. A person who is allergic to sulfonamide, and if he is taking a tablet of sulfonamide and trimethoprim with different drugs, you will get a red alert on his mobile that you are likely to be sensitive to this drug, don't consume this medicine. patient's condition with remote monitoring. If the person is having obstructive sleep apnea and his SpO2 is dropping down to less than 75 or 80, that situation, there will be alarm maybe from his wristwatch or the pocket, and the alert will be given. Support healthcare workers in normal course of their duties, and agents are very useful for information retrieval. You can restore the history of one family in one file, and that will be helpful to prevent even genetic disorders. AI includes in medicine the physical branch, physical objects, medical devices, robots for delivery, that's called as the care bots or the surgical robots. This is the way in which the reality is going to be there in future. The AI in medicine can be a virtual branch. You imagine some senior citizen who is trying to walk in a park, but his grandchildren are somewhere in US, Europe or Australia. If they are wearing the same gadget of virtual reality, they may have a feel that they are walking with their grandchildren in the park. That is the effect what they can get. So this is something really going to be revolutionary. It can be unsupervised, it can be supervised, or it can be reinforced technique for virtual reality. Forget everything. 5G enabled mobile broadband services are going to transfer the vitals through something called as the electronic skin. It is a patch. It is a patch which is applied on your wrist or some part of the skin where you can get all the TPI, except for blood pressure, you can get even blood glucose or the oxygen saturation values. There can be gene therapies for inherited retinal diseases, brain's blindness. And these gene therapies, if they can help retinal diseases, they can help anything like deadly conditions like cardiomyopathy and severe allergic respiratory disorders or the respiratory disorders which end with respiratory failure. IOMT is the next thing. Internet of Medical Things and Alphabet. Alphabet is biggest corporation of Google, which has got a huge database, and Alphabet is going to practically rule the technology segment. You are going to have virtual or a medical virtual assistants who may even remind you for patients' medications. I will suggest all of you who are looking at the geriatric population, you can prescribe Alexa or Google Home insignia for your lonely patients. There is a situation that all the people are working. I stay in our Navi Mumbai area. Almost all the houses are empty because the people go for work in the morning and they come late in the evening. The seniors are alone in the family. So Alexa will be in a position to give them instructions. This is the proactive and predictive use of technology in medical care. And here are something that you can do today to improve your health and good outcome. Last example is of Watson. Whatever the amount of doctors who are sitting here, what they can read in over 1 year, Watson can give you answer within 15 seconds. Please go to the IBM site, and it is absolutely fantastic. They can discover it because oncology is one branch which has been fantastically benefited by AI. There's a deep learning impacting healthcare. These are the various companies which are there. It is a very good alternative for the next generation. You can have very much advanced treatment plans, but there are certain limitations and shortcomings. Concerns of identity, data privacy, data sharing. Friends, I conclude with salute to my teacher, my mentor, who has thought of what we are using today 35 years back. Again, there is no point in repeating the carry home messages which I had told you right in the beginning. I cannot forget my teacher, Dr. Surtur Satish Khadilkar also showed the same picture. And these are the people, Dr. Kakrani, my senior colleague, Dr. Suresh Sinde also is there in audience. Dr. Redkar, we are the people who are idols for us, and technology is definitely going to help us. AI and digital healthcare is the intersection between two giant sectors, life science and technology. For the developed world, M-Health is an additional option, but for the developing world of ours, M-Health is the only option. I can't forget my great driving force, my family, and I conclude that desire is the starting point of all achievements. Your desire to change must be greater than your desire to stay the same. If you want to change, if you want to update yourself, and if you want to learn new things, adopt technology. Thank you very much.